everyone that was in the waiting room has entered. Good afternoon, everyone. Welcome to Mountain Pacific Quality Health weekly series, It's Worth a Shot. Today is July 27th, 2022, and this is the 28th session of It's Worth a Shot. Today, we're going to discuss updated vaccine recommendations and take a look at the national COVID-19 vaccine data. Next slide, please. As always, a few housekeeping items. Feel free to enter any webinar topics or clinician ideas or needs into the chat box, and we will continue to meet every Wednesday. Next slide, please. Oh, and we have our polling questions. Thank you, Mary. As we've kind of continue to look at our COVID-19 vaccine needs, we did a series of polling questions on looking at long-term planning to access. Now we just want to take a few moments and look at hesitancy and see if we can better align resources and tools and educational needs to address that challenge and barrier in our facility. So there's a couple questions here, if you guys wouldn't mind taking a few moments to answer. If I could get a few more people to respond, that would be great. Thank you. Maybe one more, two more. First question, how concerned are your patients, residents about getting COVID-19? Second question, how concerned are your staff members about getting COVID-19? Oh, great. We have a few more people answer, and thank you guys for your participation. This helps us to, again, better aligned resources and see how we can assist centers with this challenge. All right, Mary, I think we can go ahead and end the poll. All right, next slide, please. There we go. And once again, a special thank you to all our speakers and partners and attendees for taking the time out of your busy week to join us. You know, these weekly calls, they're meant not only to discuss vaccination needs, but also infection control and prevention needs and resources and survey guidance. So we extend a many thanks to everyone for your participation. Next slide, please. All right, without further ado, I introduce and welcome Kyla, our in-house pharmacist, and today she is going to give us some vaccine updates.
Thank you, Jessie.
Thanks, Kyla.
We can go to the next slide, Mary. So just a couple updates that came out from CDC last week. We did get final approval of a new COVID vaccine, Novavex, approved for adults 18 and older. And then just a little bit of updated guidance on the myocarditis and pericarditis cases that we can see in a certain population, primarily adolescent and young adult males. Just a couple things they added to those recommendations were that they're seeing most cases happen within several days following vaccination or up to a week afterwards. And we are seeing this more frequently in folks getting their second dose versus their first dose. Most will receive care and respond well, and they can resume their normal activities after symptoms improve. They also added the recommendation to follow up with their cardiologist or a cardiologist if they didn't previously have that person as part of their care team. So I will talk next about Novavex. So this is just the announcement from the FDA that this has been approved in 18 and older. And if we move to the next slide, there's more detailed information about the studies that were done on Novavax. It was originally studied and approved in the United Kingdom. And then starting in December 2020, we started our study here in the US and Mexico. And you can see that the efficacy is fairly high and similar to the other vaccines that we have on the market. It is a 2-dose series, 21 days apart. They actually say you can do 3 weeks up to 8 weeks apart, which is the recommendation for most of the COVID vaccines now, that we're seeing we can have a little bit bigger interval between those doses. And it is a nanoparticle vaccine, so it's not a new technology. It's actually been used for about 30 years in the United States. It's basically a protein subunit attached to an adjuvant, which is just an ingredient that helps the immune system respond to the virus. So other vaccines that use this technology are hepatitis B, some of the influenza vaccines, and our whooping cough vaccine. So this is something that we've had a lot of experience with in the last 30 years. So folks may be a little more open to this vaccine if they have concerns about the supposed mRNA technology being new and not being used in a large population. So this could be a good option for some of the more hesitant patients. Next slide, please. Just a couple resources where you can look at the EUA, the emergency use authorization. Basically, that's going to be the package insert for Novavax with the emergency use in place, and then information from the CDC website. Next slide, please. And I will say also, we haven't seen Novavax actually arrive here in Alaska yet. I'd be curious if folks have seen it in their other states, or if we're just waiting for it to be available to our patients. So if you want to chat that in, if you have seen it, if you haven't seen it. So the other thing that happened, and this happened, I think it was about 6 weeks ago to 2 months ago, we got the approval of the vaccine down to 6 months of age. So I'm going to look at what those vaccines look like. There's some really nice visuals that I think can be helpful on the next slide, please. So, of course, we have to have 4 different kinds just to make it, really straightforward. But this is, I think, is a really nice chart that you can have available when you're looking at doing the Pfizer vaccine, and it gives you all the information on if you need to dilute it, what the volume is, and there's also these QR codes that you can go directly to get more information about each formulation, which is nice. And Moderna on the next slide has a similar chart. You'll notice some of these have they have different colors on the label, but 3 of them still have a dark blue cap. So our original one was the red cap, and these new formulations are approved for the different age groups that you see at the top. Once again, there's the QR codes at the bottom here where you can go get additional information. So I think these are very helpful. Next slide, please. So this is a resource from the CDC that basically looks at each COVID vaccine, which age group it's approved for, and what the dosing regimen looks like. This is a 2-page document, actually. I just screenshotted the first page because the second page was for the immunocompromised folks. So feel free to access this. I think it's a really good resource as well to be able to kind of keep track now that we've got multiple vaccines and multiple age groups come to the table. And also, Mary, if I can share my screen. There's another resource that I wanted to share. I think we're going to put that in chat. That has basically all of the last two resources I showed in one document, including dosing for both primary vaccine and booster doses. So this is actually a 5-page document. It's got the chart on the first page, and then all the clinical considerations for specific populations, including co-administration of other vaccines, contraindications, precautions, and just different kind of specific populations and what the recommendations are for those folks. So I think this is a really good resource as well to have at your fingertips. And I think, Mary, that is my last slide, I believe, except for the resources, of course. Yep, here's a tool where you're looking at vaccines for children and teens and what their schedule looks like when they need a booster, if they need a booster. You can use the find out when to get a booster tool, which just you put your information in, it navigates you through. It's pretty handy. The at a glance chart is the one I showed, where it showed the dosing schedule for different populations and different brands. And then these are the charts that have the actual pictures in them. Does anybody have any questions? Or what questions do you have?
Kyla, it's Jessie. I have a question for you.
Okay.
How did it look like, or how does Novavax and Pfizer match up as far as the comparison between those two vaccines?
As far as efficacy?
Yes.
I think it was 93% for Novavax, and we were right around the same, 93, 94%. But you have to consider that Novavax was also studied in the original variant. So I don't think we have data. If there is data out there, I do not know what it shows for the new variants that we're seeing, because we did see a drop in efficacy for Omicron with Pfizer vaccine, definitely decreasing as we see the new variants kind of coming out.
Right.
Does that answer your question?
Yeah, no, I was just curious.
Yeah.
Thank you.
And if there is, I can do some research and put that in the Q&A for next week and see if there is any data out there for Novavax on the new variants.
Yeah, that'd be awesome. Thank you.
Okay. Yep. All right. Well, I will go ahead and turn it over to Tom.
All right. Thank you. Thanks for joining us, everybody. Today, I'm just going to take a few minutes and discuss some of the COVID vaccination data and trends currently in our nation. So if you could go to the next slide, please. First, looking at the United States at a quick glance at some of the COVID indicators. Number of cases, total cases in the United States is just under 90 million as of last week. Looking at the trend, and just so you know, these trends are just June and July of 2022. So it's just a very small snapshot. But we see the number of cases kind of leveling off as we get into later July, according to the CDC. This comes out to just under 126,000 cases per day on a 7-day average. Number of deaths in the United States is just over 1 million. The trend looks to be dropping off, which is always a good thing. And this is looking at probably close to 350 deaths per week, again on a 7-day average. Current hospitalizations, 36,554. The admission trends continue to climb a little bit, just over 6,000 hospitalizations per day, again on that 7-day average. And the number of folks age 5 and over getting their first booster shot is currently at 34.4%, which comes out to just about 107 million people in the United States. Next slide, please. Another kind of at a glance. This is looking at the number of folks who had their primary series vaccination and who are eligible for a booster dose, and those that actually received their booster dose by age group in the United States. And if you look at the population ages 50 years and over, we also have data for eligibility of the second booster and the number of folks that have received that second booster as well. Again, these are as of last week. This data comes from the CDC COVID data tracker, which is updated weekly. So I'm sure if you went out there today, this would be a little bit different. Next slide, please. Okay, this is what I like to call the roller coaster slide. This is our daily count of doses administered in the United States since the vaccine became available in December of 2020. You can see the initial climb, if you will, and somewhere around late March, early April, we administered somewhere around 4.5 million doses of the COVID vaccines. And then from there on, it has been kind of a roller coaster ride of dipping down, coming back up, et cetera, until we get to mid-July of 2022. And you can see the daily number of doses administered has gone down quite significantly from when we started. Next slide, please. Now, if we look at that same data and the cumulative count of doses by date of the vaccine administration, you can see here how we have started in December of 2020 to current. We've reached about 600 million doses administered in the United States to date. Next slide, please. Now, very similarly, this chart shows the number of people receiving their first booster dose by the date of vaccine administration. From the time the first booster dose was recommended initially, we have that climb, and again, the numbers have waned to where we are now for the number of folks receiving that first booster dose. But if we look at it cumulatively again, next slide, please. You can see here where we have climbed up to the aforementioned 107 million first booster doses administered in the United States as of July 19th, 2022. Next slide, please. I'm going to spend a little bit of time looking at vaccination rates in the nursing homes. Now, this data, the charts again are from the CDC COVID tracker. The nursing home data, of course, comes from NHSN as reported by the nursing homes themselves, long-term care facilities. So on the top, we have the percentage of residents reported with a complete vaccination. This does not include the booster. This is just the complete primary vaccination. And it's been consistently right around 87, 88% of our nursing home residents reported as having a complete vaccination. Conversely, on the bottom in the green, we have the staff, which in more recent months has also achieved that 88, 89% vaccination rate within the staff numbers. So that's a good sign for the nursing home getting vaccinated. Next slide, please. Now, as a subset of those two, we look at the percent of residents with a complete vaccine who have received either an additional primary dosage or a booster dose. And you can see since December of 2021 how we climbed to around 84, 85% of our nursing home residents have received a an additional primary dose or a booster dose. Looking at the staff, though, we're still down around that 55, 56% of the nursing home staff as receiving their booster doses. Next slide, please. Now, looking at our national map, again, looking at the percent of residents receiving their booster, most states are above 75%. The exception being Florida. So I'm not sure what's going on in Florida, but they're lagging a little bit behind in the percentage of their residents being vaccinated. Next slide, please. When we look at the staff nationwide, we see, again, most states above 40, or excuse me, less than 40%. I think that's a typo. But they should be above 40%, I thought. But we see a handful of states, though, down in the southeast corner of the nation, Florida included, that are a little bit behind the other numbers. So some work to do on the staffing booster shots. Next slide, please. Yeah, just a couple resources. As I indicated, all of the visuals come from the CDC COVID data tracker. If you've not gone out there and checked this out, it is a good source, not just for vaccines, but for most everything COVID. The charts, when you get on the website, are actually interactive. They're created in Microsoft Power BI, so you can filter down and look at counties and state levels and things that you might be interested in. The top resource is, again, the NHSN data set, where all of the NHSN data is located in raw data form if you wish to download that and do analysis on your own. So next slide then. So are there any questions that I can assist with? If you think of some later, please feel free to reach out and we will get back to you ASAP. Okay, with that, if there are no questions, I haven't looked in chat. Or is anything coming up in chat?
Yeah, Tom, it looks like there's a question in chat. For the deaths per week, the slide says per day. For 350.
Oh, it's per day, but it's on a 7-day average. So I guess that's where the week language came in. It's the way they figure that is at a 7-day average. So they say there's approximately 350 deaths per day on a 7-day average. Does that make sense?
Yeah, over a 7-day spread. Okay. Thanks,
yeah,
Tom.
that's what those averages are on that first slide. I'm sorry for the confusion.
Yeah, no problem. Kyla, we have a question for you too. With the Novavax, does that look like that's going to have a booster schedule as well?
I would anticipate that, but I don't think we know yet.
Oh, okay.
And I will, I can go back to your question earlier too, Jesse. I did find that it said there was insufficient data to say how effective Novavax is against the Omicron variant. And that's from the World Health Organization. So probably more to come on that as well.
Yeah, sounds good. Thanks for looking that up.
Absolutely. Does anybody else have anything? We have a few minutes left. Well, thank you everyone for all the work that you're doing out there and visiting with us today. And we will see you next week. Have a good rest of your week. Bye.